Dr. Brooke Goldner was diagnosed with lupus as a teen. The autoimmune condition causes pain and inflammation that can lead to permanent tissue damage. Many patients are able to manage the condition with medication and a healthy lifestyle, but the common consensus is that we don't yet have a cure for the disorder.
I had kidney failure, I had blood clots, I had mini strokes, I had chronic rashes, arthritis. I did all of that. And the only reason I'm sitting here is because of modern medicine, which is why I wanted to be a doctor. I wanted to save lives like I was saved. But medication never gave me health. It was always, I'm stable until the next thing, right? So it was like migraines, and then it was arthritis, and then my kidneys went, and then I was stable until I started getting double vision in medical school, and then it was the mini strokes, right? So life with autoimmune disease is very much like that, where medicines can help you, but they never heal you.
Goldner is a board-certified physician who specializes in using nutrition to treat autoimmune diseases. At first, she was completely on board with having to be on medication for the rest of her life to manage her lupus. But after cleaning up her diet in preparation for her wedding, Goldner realized her lupus symptoms seemed to have magically disappeared. Not only could she feel the difference, but her labs reflected a change as well, which went against everything she thought she knew.
You don't have lupus for 12 years and then your labs become normal and it goes away because you gave up Diet Coke, drink water, and started eating more salad. Didn't make sense. And it was almost offensive as a physician that it could be due to my diet. So I didn't even, I didn't understand it at first until after I had my first son, no relapse. And my husband and I went into understanding how is it that nutrition alone could have possibly caused this change.
There are many foods in the typical American diet that promote inflammation, a main component of autoimmune diseases. Red meat, refined grains, dairy, and fried foods all fall into this category and are often ultra-processed. A recent review published in the British Medical Journal shows that eating just one serving of ultra-processed foods a day is associated with a 50% higher risk of mental disorders and heart disease-related death. It also raises the risk of developing or dying from dozens of other conditions. In the average American's diet, about half of the daily calories come from ultra-processed foods. Additionally, Risa Grew, a functional nutritionist, says the chemicals added into our groceries and the ones commonly used in packaging consistently work against our health.
The body doesn't know how to process them, so they don't help the body. They don't do anything to advance the body. What they do is they hinder the body. Most of them are major endocrine disruptors, and they cause a lot of inflammation. And if you look at your labels of the foods that you're buying that are not from the farm, right, they're from a factory, look at all those chemicals. I mean, these are things you don't have in your pantry, and people eat them day in and day out. And some of them are really, really hazardous to our health.
The FDA has approved around 10,000 chemicals to date, which can affect the color, taste, and shelf life of food. But is that a good enough reason to ingest something that's proven to disrupt our hormones? Gru's had a front row seat to this hormone damage when she was diagnosed with an underactive thyroid. Instead of trying to find a root cause, her doctor immediately turned to pharmaceuticals.
He gave me some medication, and I was like, well, how long do I take this for? And he said, oh, every day. And I said, well, I mean, for how long? And he said, well, for the rest of your life. And I walked out of the office and I went, first of all, why is my thyroid not working, right? Why is it underachieving? And my second question is, why isn't he worried about why it's not working and how do we fix it? He's just giving me a synthetic medication to take care of what was my body was born to do.
She analyzed her current lifestyle and realized that cleaning up her diet made a huge difference in her symptoms. But Goldner says it's not enough to just look at what we consume. We also have to realize what we're not eating.
What I found is a lot of times I think what's making people sick is not what they're eating so much as what they're missing. So my specialty is understanding how nutrition and lifestyle affects cellular function, cellular repair, and immune function. And so when you're looking at those things, you go, okay, so if cells are damaged by stress and McDonald's or whatever it is, or fast food, I won't pull out one name. All right, so if you're damaging your cells from those different things in your life, what do you need to repair it? All right, vitamins, minerals, antioxidants. All right, cool. Where do you get that? Plants, the highest form, the greatest density of those nutrients are in things like cruciferous vegetables.
Vegetables like leafy greens, cabbage, and broccoli are some of the most nutrient-dense foods you can eat. Because of this, Goldner likes to overwhelm her patients' diets with these vegetables.
Unlike with medication, where if you have too much, you can also get sick. With nutrition, you have too much, it goes into the toilet. That's fine, right? So I really focus on the cruciferous vegetables because then we can get all that cellular repair.
The second nutrient that Goldner believes is a key to our health is omega-3 fatty acids. The NIH reports that omega-3s can lower your risk of heart disease and have been hypothesized to reduce the risk of cancer due to their anti-inflammatory effects. Though they're typically found in fish, you can also get your daily dose of omega-3 through flax seeds, chia seeds, and walnuts. But if you're focused on what to do right now that can improve your health, one of the easiest things is to increase your water intake.
Most people are extremely dehydrated. And if you're dehydrated, the cells just don't get better. Brain doesn't work properly. Immune system doesn't work properly. So I usually get people really hydrated, like 96 ounces or more. So, how much people do, it depends how sick you are. If you're otherwise feeling pretty healthy, adding those foods to your diet, you're going to have a nice layer of protection against getting sick. But if you're already sick, then of course, I'm going to be more aggressive and say, well, let's stop getting sicker for now. Let's work on your stress. Let's work on your eliminating all that other junk you're eating and focus on eating these other healthier foods. And it's to show people that this is not just purely genetic, but really it's a result of how we're treating ourselves and we can fix it.
As we mentioned earlier, the current consensus in medicine is that autoimmune diseases cannot be cured. However, the symptoms can be either managed or made so much worse by a patient's diet. In Goldner's case, she's been symptom-free for nearly 2 decades since realizing how powerful a strict, healthy diet can be. Goldner recently published a study in Frontiers in Nutrition to show that a raw, whole, plant-based diet can rapidly heal lupus and Sjogren's syndrome.
Lupus causes systemic issues, so rashes, joint pain, etc. Sjogren's specifically attacks your glands. So people with Sjogren's get extremely dry eyes, dry mouth. It can also cause dry vaginal secretions, dry skin, but dry eyes and dry mouth is torture for people. I mean, it can get so severe where they have to put these giant lenses in over the entire whites of their eyes, full of eye drops just to be able to not have their eyelids stick to their eyes. I mean, it is extremely painful. So all of them had both of these diseases, and all of them were highly symptomatic with both diseases on medicines when I met them.
Though it's a very limited study that only includes 3 women, Goldner says it's a public showcase that changing your diet can have lasting effects on your autoimmune disease. She put each patient on a highly restrictive diet that's made up of those nutrients we mentioned earlier, like raw vegetables.
We're focusing on getting in as much of the cruciferous raw vegetables as we can, omega-3 fatty acids from flax and chia seeds or flax oil, and water intake. So for example, easy way to do that, green smoothie, right? Put kale into the blender, add flax or chia seeds to that, add the water, and then put in bananas, mango, pineapple for flavor. That's a spoonful of sugar to make the medicine go down, right? They can have some fruit too. And then they drink that. Then they have a big salad. Then maybe they have some broccoli dipped in guacamole. So we're focusing on raw foods that are going to create that rapid effect.
All 3 women saw improvements in their symptoms within 4 weeks of changing their diets.
What the study showed is that all of them continued to be healthy after their own doctors took them off medicine. So I'm not their rheumatologist. I am their lifestyle specialist. All of their doctors took them off their medications within that year, and they've all remained symptom-free off all medications. 2 out of 3, it's been over 6 years, one 7 years, 8 years, and one that's only been 4 years since I worked with her. But all of them from 2 to 4 weeks after changing their nutrition were able to become symptom-free and stay symptom-free even all these years later.
Goldner admits it's not for the faint of heart. It's a tough diet to follow, but absolutely worth it for her patients that have seen success. Once her patients have gotten their disease under control and are feeling symptom-free, Goldner says they can add some items back into their diet, but it's by no means close to the average Americans.
And that's what these folks in the study did, is they then went into what I call step down, where they added back cooked food, but kept their high raw diet, 60, 70% raw or more, and they maintained their health all these years, just as I have. And once you've been healthy for like 6 months or more, if you have the occasional Impossible Burger or you have the occasional vegan donut, you're not going to get sick. But strict when they're sick and then more lenient when they're well, and you can maintain those results.
Some people who don't want to commit to such a strict diet may think there's an easier way out through supplementation. Sadly, Goldner says this multi-billion-dollar industry that's widely unregulated can never replace whole foods.
I wish that supplements worked as well as food. It would be so much easier to convince someone to take a daily multivitamin than to convince them to eat a pound of greens a day. It's just that we keep thinking we're going to outsmart nature, and all we're doing is harming ourselves. You have to eat the foods for it to work. I mean, people are spending so much money taking all these different vitamins and supplements, sometimes causing harm, other times just creating expensive urine. Whereas if you just would eat the right foods, you just go to the supermarket, you can get the foods you need to get healthy. It doesn't have to be a supplement made from something that only grows like in some rainforest somewhere.
You can find more information about Dr. Brooke Goldner, Risa Grew, and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our executive producer is Amira Zaveri. I'm Elizabeth Westfield.